Hi, welcome back to Blood Talks. Today we are going to be talking about hematocrit. I will include what it is, what can hematocrit tell you about your patient, what does it mean when it's high, what does it mean when it's low, and all that fun stuff. Without further ado, let's get into it. Hematocrit is the percentage by volumes of red blood cells in your blood. Hematocrit together with hemoglobin is what we use to determine anemia status of a patient. A reference range can be varied depending on age, sex, geography, but in general, adult males have hematocrit between 42 and 52%, adult females 37 to 47%, infant and child 30 to 43%, and newborns 53 to 65%. Adult males generally have a higher hematocrit when compared to adult females on average because males in general have a higher percentage of muscles to fat. Therefore, the body requires more red blood cells to transport all the necessary oxygens to all these muscles. Generally speaking, infants and child have a higher body fat than muscles, so the hematocrit is not as high as adults. Newborns tend to have a higher hematocrit level than adults because they require more oxygen as they are developing inside the wombs. The high hemoglobin leads to high hematocrit. Remember, these two go together like semi-twins. So high hemoglobin, high hematocrit. The hematocrit level decreases gradually to an infant's level several weeks after the baby is born. How do you determine hematocrit level? In our scope of interest, blood, or what we call whole blood, is composed of plasma, red blood cells, platelet, and white blood cells. We can see these components by centrifugal whole blood, and we will see three separate layers. The topmost layer is the plasma or serums. Side note, we call this layer plasma when it still have coagulation factor in the liquid portion, whereas when we call it serums, this top layer doesn't contain coagulation factor anymore because when we collect it, we allow the blood to clot before centrifuge it down. So to call it plasma or serums, it just depends on what tube we use when we collect it. We can see these components by centrifugal whole blood, and we will see three separate layers. The topmost layer is the plasma or serums. Side note, we call this layer plasma when it still have coagulation factor in the liquid portion, whereas when we call it serums, this top layer doesn't contain coagulation factor anymore because when we collect it, we allow the blood to clot before centrifuge it down. So to call it plasma or serums, it just depends on what tube we use when we collect it. The next layer is a thin white, off-white or cream layer. It is your white blood cells and platelet layers. Once you spin the whole blood down, this is the middle layer. It is usually the smallest layer. A thick layer indicates an infection. Why is that? It is because the number of white blood cells increase as a part of immune response to infections. It's the white blood cell that helps you fight an infection. The last layer is the red blood cells. It is at the bottom because the red blood cells is the heaviest compared to other components. So the hematocrit is the percentage of red blood cells in your blood. This is 100% and this is about 53% of the total volumes from this tube, and that 53% is your hematocrit. Side note, this is why proper blood collection is so important. If the tourniquet were to left on the patient's arm for too long, this can cause hemoconcentrations, which leads to a high hematocrit, and that could lead to a wrong treatment for the patient. Improper blood collection technique can turn into a vigorous cycle of mismanaging patient medical needs. For instance, improper blood collection technique by phlebotomists lead to CLS report results that is not truly represents of the patient health conditions. And then the doctor reviews the results and orders the care plan. The nurse executes the care for the patients according to the doctor order. You see, we just went down the rabbit hole of mismanaging the patient health. I just want to point that out to you and show you how it's all connected. So next time you go to the hospital, be nice to your phlebotomist and be thankful to the CLSs because the CLSs are the people you never meet when you go to the hospitals, but they are the one who keeping the doctor from killing you by telling them exactly what's going on inside your body biochemically. Now we can get back to hematocrit. What can influence hematocrit? Dehydration level can greatly influence your hematocrit level. A dehydrated person will have a higher hematocrit than a well-hydrated person. Your hemoglobins also influence your hematocrit level. Like I said earlier, hemoglobins and hematocrits are like a pair of semi-twins. When hemoglobin is increased, hematocrits also increase. When hemoglobin decrease, hematocrits also decrease. High red blood cells, high number of giant platelets, and autoagglutinations can give the impressions of higher hematocrit than what it actually is. Also, patient health conditions or illnesses also determine hematocrit. A condition like polycythemia vera, which causes the body to produce higher number of red blood cells than normal, these directly cause the hematocrit to increase. Is it always a good thing to have a high hematocrit? What happens when you have a high hematocrit? Just like everything else, too much of something is never good. High hematocrit indicate high red blood cells and that cause your blood to thicken. When your blood is thick, your blood cannot flow fully anymore and may not be able to pass through those small capillaries in your extremities. On another hand, what does it mean or what it tell you when it's low? You guess it and it is correct. A low hematocrit is an indication of anemia. The patients may need a blood transfusions. This could be critical and the patients could die if left untreated. Thank you for staying with me until the end. What do you want to know next? Do you want to know more about blood bank, chemistry, or microbiology? If you have any burning questions, please feel free to leave me a comment down below. Lastly, if you have not done so, please like, share, subscribe, and click that notification bell. I will see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Thanks for watching. Bye.